make at this point. They expect us to try and get this job done. Senator Sanders.
Well, Mr. Chairman.
Well, thank you. Thank you very much, Mr. Chairman. And I agree with almost everything you said. The essential problem that we have is that unlike every other major country on earth, we don't have a health care system. We have some people who say the cost of health care is stressing out the federal government. That's an important point. But you've made an equally important point. You've looked at millions and millions of people who today don't have any coverage, who are also being stressed out. And we have an obligation, a moral obligation, to look at them. One statistic that you didn't mention, which I think we need to put on the table. I know that some of the insurance companies will be putting ads on television telling all of the horror stories about Canada and England. Well, let's talk about one other horror story we don't talk about enough in this country. According to the Institute of Medicine, close to 20,000 Americans die, D-I-E, every single day, every single year. And you know why they die every single year? Because they don't have access to a doctor on a regular basis. Every person here has heard that horror story, talking to physicians who said to a patient, why didn't you come in to me earlier? You are now very, very sick. And they lose those patients, or those patients run up huge bills in a hospital because they don't have access to a doctor. Is that what the United States of America is about? Now, frankly, one of the questions that we have not delved into at great enough length, in my opinion, Mr. Chairman, is a very simple one. We can argue, and people do, medical economists argue, what healthcare system in the world is the best, what healthcare system in the world is the most cost-effective, and frankly, people disagree with that. Generally speaking, economists have looked at countries like France, which provide universal coverage to all of their people. People do not go bankrupt in France. By the way, in terms of bankruptcy, this year, when we talk about financial problems, some people here might be interested to know there are estimates that up to 1 million Americans go bankrupt, have gone bankrupt this year as a result of medical-related costs. 1 million. Is that an issue that we should be concerned about? Yeah, I think so. Million families seeing their financial resources thrown away. Why is it? Why is it that our healthcare system is so expensive and leaves 46 million without any insurance, even more underinsured, close to 20,000 people a year dying? Why is that? Do we talk about it? And one of the reasons I think we've got to talk about is that we have 1,300 private health insurance systems. And what is the function of a private health insurance system? Does anyone think it's to provide health care to people? It's not. It's to make as much money as it possibly can. Now, I want to just touch on a few issues that I haven't heard discussed. People talk about the problems of government, they talk about this and that. Let's talk about some. When you talk about the high cost of health care, is it appropriate to talk about some of the salaries that people in health care are making? Do we really think it's a good idea that people, at a time when 46 million Americans can't afford any health insurance, there are people in the healthcare industry making huge salaries? Johnson & Johnson, major pharmaceutical company, found the cash to pay its CEO, Bill Wilden, $31 million in 2007. That a good way to spend healthcare dollars? Ron Williams, the head of Aetna, who testified before this committee, concerned about cost effectiveness, $38 million in a year. Not a good way to be spending health care dollars. In my own small state of Vermont, my own small state, 630,000 people, the fellow who left Blue Cross Blue Shield, was the head of it, got a $6.3 million golden parachute. Think that's a good way to be spending health care dollars when people can't afford health care in this country? The reality is that CEO compensation at the top 7 health insurance companies in America now averages over $14 million a year. Okay? Now, in 2009, HHS Inspector General reported that 80% of the insurance companies participating in Medicare Part D, the prescription drug benefit, have overcharged subscribers and taxpayers, totaling an estimated $4.4 billion. How's that? Not a good way to be spending taxpayer money? Typical estimates of the level of Medicare and Medicaid fraud are around $60 billion. Now, I want to just touch on, because we haven't gotten into this, to make a simple point. We have, uniquely in the industrialized world, a healthcare non-system which is dominated by private corporate interests. I just want to touch on a few of those aspects of that. When you talk about healthcare costs in America, you're always talking about the cost of medicine. Prescription drugs are very expensive. In America, of course, we pay by far the highest prices in the world for prescription drugs. Let's just talk about some of the major pharmaceutical companies and the role they play in making our healthcare system by far the most expensive in the world. Let's start off with the largest, Pfizer. Some of you may know this, but just this year a jury found that Pfizer owed the state of Wisconsin $9 million for violating Wisconsin's Medicaid fraud law more than 1.4 million times. The company faces potential fines of between $140 million and $21 billion. In 2004, Warner Lambert, a division of Pfizer, pled guilty to 2 felonies and agreed to pay $430 million. $430 million to settle charges that it fraudulently promoted a drug, one particular drug, for a string of unapproved use, and included in the award was a criminal fine of $240 million. In 2002, Pfizer agreed to pay $49 million to settle charges that a subsidiary defrauded the Medicaid program by overcharging for Lipitor. Huge fines. Johnson & Johnson the Texas Attorney General charged Johnson & Johnson with funneling kickbacks to Texas health officials. Johnson & Johnson. GlaxoSmithKline agreed to pay $14 million to the state of California. They also signed a corporate integrity agreement and paid $88 million in civil fines for overcharging Medicaid. Hoffman LaRoche, $500 million in 1999 criminal fine for leading a worldwide conspiracy to raise and fix prices and allocate market shares for certain vitamins. Sanofi Aventis, 2009, Aventis paid $95 million to settle charges that had violated the False Claims Act. Wyeth, just this year, the U.S. government and 16 states have joined in 2 whistleblower suits against pharmaceutical giant Wyeth. The drug company allegedly failed to pay hundreds of millions of dollars in rebates to the Medicaid program. You know, I hear a lot about fraud and I hear a lot about waste. But what I don't hear about is the role that the major corporate giants in the healthcare industry are playing in ripping off the American people to the tunes of billions and billions of dollars. I don't know why we don't talk about that issue. That's just the drug companies. Huge fine after huge fine. And let's be clear, especially under the Bush administration, whose competence is not widely respected, and who is also known as being sympathetic to corporate interest, every fine, every charge that we have seen here, probably you can multiply many times over, that they're sitting out there with an aggressive Attorney General's office might have gone after. Let's look at some of the private insurance companies that some people here see as a model that we want to support. United Health, 2009, United Health paid $350 million to settle lawsuits brought by the AMA, state medical societies, doctors, and patients. These lawsuits allege that the company shortchanged consumers and physicians when paying for medical services outside of its preferred network. WellPoint, in 2009, CMS barred WellPoint from participating in Medicare Part D and Medicare Advantage, stating that WellPoint has demonstrated a long-standing and persistent failure to comply with CMS requirements for proper administration of its Medicare Advantage prescription drug program. Aetna, in 2003, Aetna agreed to settle a class action suit brought by physicians by paying a $470 million and overhauling business practices that doctors say have shortchanged patient care. Humana, in 2000, Humana paid $14.5 million to settle federal charges of overcharging government health programs. Cigna, in 2003, Cigna paid $24.5 million to settle allegations of Medicare fraud at a hospital it owns. All right? That's just some of what insurance companies are doing. Then you got private hospital chains. I think many people here are familiar with that. In fact, in 2000, the Hospital Corporation of America agreed to pay $745 million. $745 million to settle civil charges that it systemically defrauded Medicare, Medicaid, and other federally funded health care programs. Later that year, HCA agreed to pay criminal fines and damages of $95 million. Finally, in 2003, HCA agreed to pay $631 million more in civil fines, total of $1.7 billion. Tenet Healthcare Corporation, 2003, Tenet paid $54 million in fines to settle allegations of 2 doctors working in Redding, California, performed unnecessary cardiac procedures on patients in the interest of profits. Imagine that. Cardiac surgery in order to make money when that surgery was not necessary. 2006, Tenet agreed to pay $725 million in cash in order to resolve claims that defrauded the federal government, overbilling Medicare claims during a 6-year period. And on and on and on it goes. So when we hear, and Mr. Chairman, I would ask unanimous consent to enter this information into the record.
Without objection, so ordered.
You know, Mr. President, I get a little bit tired of hearing about how the government can't do anything. Government can't do anything. Well, you know what? What you have seen for many, many years is a systemic effort on the part of private insurance companies, private drug companies, private for-profit hospitals, to the tune of many, many billions of dollars, are ripping off the American people and the taxpayers of this country. And then you wonder why in the New York Times people say overwhelmingly they want a government plan to compete with the private sector. No kidding, isn't that a shock? Very few people in this country have a great deal of confidence in private insurance companies. They know that we're paying the highest prices in the world for pharmaceuticals. We get ripped off every day by the drug companies. So I just say these words, Mr. President. I don't have an amendment to offer today to deal with this stuff. But clearly we need to think about how we're going to stop the illegal, systemic, illegal behavior of many of these large corporate interests who are costing our people, our taxpayers, billions and billions of dollars. And that is something I think we'll have when we get to the floor of the House. But I thank you,
thank you, Senator.
Mr. Chairman.
Mr. Chairman.